Hey guys, good evening. Good evening, everybody. We're going to get started in a moment. I am just going to YouTube so I can pull up the video so I can easily see the YouTube comments. And then I'm going to go to Facebook so I can share in the group that I am currently live. Let me go to Facebook. Oopsie, it was right there. Live study. Oops. Live certification prep, administrative, live administrative. Let me make sure I live administrative certification prep. Okay. All right. So I just shared that into the group. We're going to get ready to get started. Without further ado, we're going to just get ready to get this started. Okay. So I see you guys in the comments. I am going to, if you have any questions, just please save it for the end. I will answer questions at the end. We're going to get ready to get this started. Let me remove this banner here. So tonight we're going to be doing administrative prep, okay? For anybody that is joining us for the very first time, I just want to introduce myself. My name is Kendra, aka Miss K. I'm a medical assistant instructor. I've been an instructor since 2011. I've been an MA since 2004. My very first job, though, is mommy. I'm also an author and an entrepreneur. These are some of my products: t-shirts, medical assistant t-shirts, mugs, stethoscope necklace, pillow, you name it, all things medical assistant. So that's on my site. These are some of my items. Oh, April, I see you're in Tampa. How are things going down there, April? Let us know. If anybody else is watching from Florida, you guys are in my prayers. I have really been praying, guys. I've been praying for Florida and just praying that the storm weakens. I saw somebody on Instagram earlier. She said that where she was, at least it went from a category 5 to a category 2. So I am happy. Oh wow, April, I'm sorry to hear that. She said definitely flooded and no power. Wow, I'm so sorry, April. Wow, even in the midst of that, you are here. Thank you for joining, April. I think I don't want to say your name right. Last name is Germaine, is in Miami, Florida. Are you getting any of it, Miss Germaine? I don't want to say your first name wrong. Chicago. Hi, Lisa. So for those of you that are in Florida, my prayers are with you. I hope that you guys are safe, and I am very sorry about what's going on down there. I just hope and pray that it weakens and it's over soon. Let me go here. Let me go to these comments so I can see if anybody on Facebook. I see YouTube. Let me see. Oh, okay, from Fort Worth, Texas, but live in New Mexico. Nice to meet you, Amaya. Okay, so we're going to get into it. For anybody that may be joining for the first time, I'm going to show you guys the screen. Oh, wait a minute. I thought I was live on Instagram already. Sorry, guys. I always do that. I think I'm live and I'm not live over there. But anyway, guys, we're going to go ahead and get this started. I'm not going to keep you guys too late tonight, but what we're doing tonight, we're doing administrative practice, okay? So this practice tonight is going to help you with the administrative portion of the certification, and it's also going to help you with the CMAA and the CMAS. So let's get into it. What is the federal law that protects the privacy and security of patients, medical information, and provides patients with rights regarding their health information? What federal law protects the privacy and security of patients' medical information and provides patients with rights regarding their health information? What is that? Okay, so I'm seeing your responses. And keep in mind, guys, I see a bunch of people typing HIPPA. Remember, guys, it's HIPAA, okay? The Health Insurance Portability and Accountability Act, okay? It's not two P's, it's portability, okay? Health insurance portability, that refers to patients being able to take their insurance with them when they change employers, okay? So remember, HIPAA is not just about privacy, it's also about insurance. So the insurance portability refers to patients being able to take their, or members being able to take their insurance with them when they change jobs, okay? The A is the second provision that holds us medical professionals accountable to keep information private. So remember that ability and accountability, then you'll remember that it's HIPAA, not HIPPA, okay? Y'all got that? All right. This is a fixed amount insurance claim with the remainder of the costs covered by the insurer. Okay, so this is a fixed amount that the patient pays at the time of service. It's fixed amount. Key word in that one is the fixed amount. A fixed amount. Hey, I have a bad connection. Are you guys saying I have a bad connection? Can you guys hear me? Oh man, y'all can't hear me? Somebody's, oh, you guys said I'm breaking up. Oh man, going in and out. Oh my goodness, I hate that. I hate that. Oh my goodness. Okay, let me know if it goes out. Everybody's saying it. Okay, let me do this. Hold on one second. Let me I'm going to move my computer, but what I want to do first, I'm going to log into StreamYard from my phone first because let me see. Let me log into StreamYard from my phone because if my computer cuts off, at least I'll still be logged and it won't end it. Okay. So let me come in here first. You guys may hear a little static as I'm joining from my phone. So hold on one second. Okay, guys, I'm back. Let me know if this is better. I moved downstairs, so hopefully we won't have any other issues. Okay, so just let me know if I break up again. Thank y'all for letting me know. I had no idea it was breaking up. Thank you, guys. Okay, so this is copay or copayment. Okay, so if you put copayment, you are correct. Okay, so somebody said it's good. Okay. Somebody say it's a lot better. Okay, perfect, perfect. And Maya, I see you asked me what's my Instagram name. It's the same as YouTube. So for anybody, I don't really post on Instagram, but sometimes if anybody wants to follow me on Instagram, it is at Medical Assistant with Miss K. Same thing on Facebook as well. So this is amounts that a patient must pay out of pocket before their insurance begins to cover expenses. Yep, this is the deductible. Yep. Okay, let me turn that down. All right. A digital version of a patient's paper chart that contains their medical history, diagnoses, medications, treatment plans, immunization dates, allergies, and test results. A digital version of a patient's paper chart that contains all of their medical history and all of their medical history and treatment plans and all of that good stuff. EHR. So somebody said, can you explain the difference between the two? Absolutely, yeah. So EMR is usually confined to one office, one practice, whereas EHR, it is comprised, is bigger and you can do more and it's across different practices. It allows information between other practices. So if you guys have something like Epic, right? I'll use Epic for an example. Epic is a big EHR system, very popular, and it allows us to send information to other practices, other companies. We can fax through it. We can we can send digitally, and also other practices can also have special access to our EHR as well. So it's just bigger. Again, EMR is usually confined to like one practice, whereas the EHR is bigger and it allows for other practices, other companies to have access, and we can do so much more with it. And then somebody said, can you explain the difference between the deductible and copayment? Okay, so good question. So deductible, so look at it like this. The easiest way for me to explain it is to think about car insurance, right? So you guys know with car insurance, when you get a deductible, let's say your deductible is $500. If you get in a car accident, or if if you're the cause of the accident, you have to pay for it. Before insurance will pay anything, you know how you have to pay that $500 deductible? That's what they mean by deductible. Whereas you have to pay that amount. And once you meet that amount, let's say your deductible was $2,000 for the year. Once you pay $2,000, the insurance will fully start to pay out. Okay. Until then, they're only paying part of the visit, right? Whereas a copay, it is consistent. You're always going to have that copay amount. Now, the copay amounts can vary. You may have a $10 PCP amount to pay. You may have a $25 specialist, or when you go to the ER, you might have to pay $50. So that's the difference between the two. The copay is going to stay the same no matter what. The deductible is something that you're paying down. So if you meet your deductible for the year, then they're paying the full amount. Whereas you still may have a co-insurance. So if you have a co-insurance, that means that even after the deductible has been met, you still have a percentage to pay. And your co-insurance could possibly be 80-20, meaning like, or 80-20, meaning that they'll pay 80% of the visit and you pay 20%. So hopefully that makes sense. So those are a couple of good questions. So this is good stuff because I do want to make sure you guys understand these things, because you will see it on a test. And you also just need to know this if you're working in the field, especially if you're on the administrative side. All right. A standard paper claim form used by healthcare providers to bill insurance companies for services provided, also known as the universal claim form. You're welcome. Standard paper claim form, and this is also called also called universal claim form. GG Star. Okay, thank you, GG Star. Thank you over here on Instagram. Thank you for letting me know. I moved to a better spot. All right, so let's go back here. Yep, CMS 1500. Somebody put in the chat, what is the claim form for inpatient? All right, a statement provided by an insurance company to explain what services were covered, what was paid, and any remaining balance that the patient may owe. And this goes to the patient. Okay, this is a statement that goes to the patient. Okay. Yep, explanation of benefits. This explanation of benefits goes to the patient, okay? And I'll give you guys just a little bit more to that. So there's another type of explanation of benefits that goes to the provider, and that is the remittance advice, okay? So make sure you guys write that down. The remittance advice, that is another type of explanation of benefits, but that's the one that goes to the provider. So keyword when it's asking about this very same thing that, you know, shows what was paid and all of that and what is still owed, that goes to the patient. Okay, that's the EOB. The one that goes to the provider is the remittance advice. Okay. A form signed by the patient authorizing their insurance company to pay the healthcare provider directly for services. Um, hold on. What is it? Hold on. I forgot what it stands for. Hold on. Oh my goodness. Oh, duh. Okay. Somebody said not sure. The assignment of benefits. So that's the assignment of benefits. So we mentioned the explanation of benefits. It is the statement that shows what was paid and everything, right? Or what may still be owed. The assignment of benefits is what the patient signs that allows the provider to bill the insurance directly. Okay. So it is the patient is assigning their benefits to the provider. Another way they may ask that. So that's one way they may say this form allows the patient to assign their benefits to the provider. Another way they may ask is it may say what form allows the provider to bill the insurance. That's another way they may ask it. Okay, so in simple forms, this form allows the doctor to bill the insurance and get the money. Okay, the patient has to sign this. A document used in medical offices to record the services provided to a patient and their associated charges, often used for billing and insurance claims. So this is a document that's used to record the services provided to a patient and their charges, and we often use this for billing and insurance claims. Let me go back to Instagram and see how y'all doing over there. Let me see. ABN is advanced beneficiary notice. That's actually what Medicare patients sign to acknowledge that their services may not be paid for. CMS, Centers for Medicare and Medicaid. Centers for Medicare and Medicaid Services. Okay. If you put encounter or super bill, you are correct. So the encounter form is used to ensure accurate billing. So I'm gonna give you guys a couple more ways, and let me go back to this just really quickly. So encounter forms are used to record the services. So another way that encounter form may be explained, it may also say a pre-printed form with codes on it. All right, pre-printed form with codes on it that's used for billing. It may say what form is used to ensure accurate billing. It's the encounter form because the provider fills this out and then they give it to the office staff, the person that's in charge of billing, and then that person uses the encounter form to fill out the claim form. Many people get the encounter form and claim form mixed up, but it's not the same thing. The encounter form helps us fill out the claim form. All right, so it's a list of pre-printed bill, pre-printed charges, pre-printed, ICD-10 codes and CPT codes that we use to fill out the claim form. And the provider will check off whatever they did. They'll check off the CPT codes as well as the diagnosis codes. Next question. The process of prioritizing patients based on the severity of their condition to ensure that those who need urgent care receive it first. What is that process called? And Annabella on Instagram, I see you got that correct. Super Bill. Yeah. So Instagram, I'm sorry, I can't see you guys on the same screen. I can see Facebook and Instagram and Facebook and YouTube. So I'm just trying to multitask. All right. If you said triage, you are correct. You are correct. A written order from a primary care physician for a patient to see a specialist or receive certain medical services. Let's see. Yep, a referral. And one thing I want to stop right here for 1 second to remind you guys that every patient does not necessarily need a referral. It's based on the insurances. Okay, definitely HMOs, they require referral for a specialist. Now, if you guys see a question on your certification that says like, which of the following does a patient need before a test is done, they'll throw in referral. It'll be order form, and they'll throw in some other stuff. Remember, it's an order. So everybody absolutely needs an order, but not everybody needs a referral. Okay, it's based on the insurance. Okay. Basic information about a patient, such as name, address, date of birth, gender, phone number, and insurance details. It is collected and stored in the medical records, in their medical records. It's their basic information, their name, address, the insurance information. What is that called? What is that information called? Yanni, I see you still here, huh? Yanni done passed her test yesterday. She's still hanging in there with us. Okay, so if you said patient demographics, you are correct. So I see somebody on Instagram said face sheet. So face sheet, so you're referring to the to that registration form. We do call it a face sheet, but the information is the patient demographic information. All right. Codes used to classify and code diagnoses, symptoms, and procedures for insurance, billing, and documentation. So codes used to classify and code diagnoses, symptoms, and procedures for insurance, billing, and documentation. All right, so if you put ICD-10 codes, you are correct. ICD-10 codes, they can be the patient's diagnosis or symptoms or the reason that they're there. So remember, ICD-10 code can be the diagnosis code, right? The ICD-10 code also represents symptoms. So let's say the patient had chest pain or whatever. It's not necessarily a diagnosis, but it's a symptom. So ICD-10 code can be a symptom. And it can also be the reason why the patient was there. That's why they mentioned the procedure in it. Like it could be they were there for physical. Their physical is their ICD-10 code. Okay. All right. Now, these codes are used to describe medical, surgical, and diagnostic services used for billing and documentation. So this describes procedures. I know the word procedure threw you off. I know, Brittany. I bet it did. I should have taken that out. I bet it did. Sorry about that confusion. So this one is CPT code. It describes procedures. Let me go back to this. It describes medical procedures, surgical procedures, and diagnostic services. Okay, these are procedure codes. CPT codes are procedural codes. So sorry for anybody that got confused by the other one, but I do want you guys to know that ICD-10 codes also can be what the pay is, also can be like a type of a visit. For an example, a physical exam is technically a procedure, right? That's why the patient is there, and that can be an ICD-10 code. But yeah, CPT codes are procedure codes, and then ICD-10 codes are diagnoses and of course symptoms. A legal document that explains a medical procedure or treatment, its risk, benefits, and alternatives, and confirms that the patient agrees to undergo the treatment. Minnie, are you still watching? I'm sorry, I'm just now seeing your comment on Facebook. Yes, this is going to be saved. Yep. Once it ends, the only place it doesn't save is on Instagram, unfortunately. But everywhere else it does save. So anybody watching on Instagram that may want to see this again later, you will have to watch it on my YouTube channel. And it's the same name, Medical Assistant with Miss K. All right, informed consent. The patient is signing that they agree to the treatment, they understand the risks, the benefits, and that there are alternative treatments available, and that is informed consent. A legal document in which a person specifies their wishes for medical treatment in case they become unable to communicate their decisions due to illness or incapacity. A legal document in which a person specifies their wishes for medical treatment in case they become unable to communicate their decisions due to illness or incapacity. Okay, so this is going to be an advanced directive. A living will is a type of advanced directive, so you're not wrong. And don't worry, you will never have to choose between the two, so don't worry. But a living will, you are correct. It is what the patient puts into place for their medical decisions if they become incapacitated. So you're not incorrect, because an advanced directive is a broader term, but a living will is a type of advanced directive, okay? So within that advanced directive is the living will, which states what they want, right? Also, they may have a DNR, do not resuscitate order, right? They within that advanced directive, they will appoint a durable power of attorney, and that's the person that makes decisions, right? Or a healthcare proxy. Okay. So don't worry, you will not have to choose. They will never ask that question and then have to choose between advanced directive and living will. Don't worry. And some people use them interchangeably, but a living will technically falls within an advanced directive. So my MA refresher course, guys, I want to make sure I show you guys that while we are on here for anybody who needs a study guide. Okay. There are over 400 practice questions on the clinical study guide. And then on my administrative study guide, I want to say there's about maybe 200 and some. There's not as many on the administrative study guide, but on the clinical study guide, there are over 400 practice questions. So in this video, I'm just showing you guys an example of how it looks when you're taking the quiz. Okay. A form that a patient must sign to allow their medical information to be shared with others, such as another healthcare provider or an insurance company. You're welcome, Taylor. I used to have a student named Taylor. She was one of my favorites too. Yep, authorization to release medical records, release of information. Yep, medical release form. As you guys see, they're used interchangeably. Yep, release of information, medical release form, authorization to release medical records. Yep. The process of recording patient care, services, and medical information in a patient's chart or medical record. What are you doing when you're doing that? So when you're recording patient care, services, and medical information in a patient's chart, or medical record, what are you doing? What are you doing? What's that process called? What are you doing? So yeah, it's a type of documentation. They're referring to charting. So when you're charting, when you're making a documentation, they're referring to charting. So filing is when you are placing the medical records back. So when you're filing, they're referring to filing the charts. But in this case, you are entering information in. So whatever you did for the patient. So yeah, you are documenting, but they refer to that as charting. So you guys hit charting, that means that you're entering in. And let me go back to it for 1 second so you guys can see that. So that's just the process of you recording the patient care, your services you did, medical information, and the chart of medical record. That's referred to as charting. Okay. The money owed to a medical practice for services provided, typically from patients or insurance companies. What is that called? The money that is owed to the medical practice. The money that is owed to us. What is that called? Money owed to the medical practice. All right. If you put accounts receivable, you are correct. That is money owed to us by the patients, by insurance companies, right? Whoever owes us money, that is accounts receivable. Okay. The money a medical practice owes to vendors or suppliers for products and services, what is that called? So this is money that we owe. All right. So if you put accounts payable, you are correct. So money that we owe is accounts payable. Accounts that are, or people that owe us money, are accounts receivable. A reminder system that helps track important dates and deadlines, such as follow-up appointments, insurance renewals, or required documentation. Reminder system. Yep. Tickler file, that's a reminder system. Yep. And usually we'll use those. So I'll give you guys an example of how you would use those. So I used to work in a GYN office, and every time a woman came in for her well woman visit, her yearly visit, we filled out a letter. We pre-filled the letter and we put it in the Tickler file. And so the Tickler file was by month, right, and year. And so what happened is every month we will pull from that file and we will be able to send a letter to a patient that her well woman visit was due. So for an example, let's say a woman came in today, right? Today is 10/10/24. So as she's leaving out, we have pre-filled a letter. We put it in the Tickler file so that way we can pull it next year, 2025. We pull it in September. So a month before, we will send out a letter and say, hey, Ms. Johnson, you're due for your annual visit. So that's an example of how you use a Tickler file. And then sometimes, like even in cardiology, let's say the doctor would say, okay, I want to see this patient back in a year. Same thing, the recall letters. We would do that right then and there. As the patient left, we would pre-do it and put it in a Tickler file. So that way, a year from now, we will make sure. So every month you're pulling it. Okay, you're pulling Yeah, I can go back. Somebody said, can we see the question again? Yeah. So it just helps you to make sure you are following up with patients that need to be seen at a certain time. And keyword in that, reminder system. You're welcome. All right, a term used when a patient misses a scheduled appointment without notifying the office in advance. So they missed the appointment without notifying the office in advance. Yep, no show. The justification for providing a specific medical service, treatment, or procedure based on a patient's condition and diagnoses. The justification for providing a specific medical service, treatment, or procedure based on a patient's based on a patient's condition and diagnosis. Okay, so this is medical necessity, guys. So medical necessity, this is what the insurance company is looking for when they are going to pay. This is what the medical insurance is looking for to pay the provider. So they need the provider to show justification. So for an example, if a patient comes in with a headache, it wouldn't make sense to do an EKG on a patient. The insurance company is going to say, what is the justification? What is the medical necessity for that EKG? It needs to be like chest pain or something like that, palpitations, right? So medical necessity this is why we got to be on point with our, our diagnosis codes and everything like that, because the provider has to show medical necessity. They have to show why they did this procedure on the patient. Or let's say that the doctor ordered like let's just say a stress test or an echocardiogram. It has to make sense. Okay. And the more expensive a procedure is, the more detailed they have to be to prove medical necessity. Okay. Two-digit codes added to CPT codes to provide additional information or to indicate that a procedure or service was altered in some way without changing its definition. So these are two-digit codes that are added to a CPT code to provide more information. Let me see. Where's my Facebook people tonight? I don't see a lot of Facebook. Hey, David. Oh, I see David is on Facebook. I don't see a lot of Facebook people tonight. Yep, if you put modifiers, you are correct. So modifiers add more information about CPT codes. For ICD-10 codes, they make the ICD-10 code more specific. Okay. A list of fees charged for specific medical services and procedures, often set by the healthcare provider or insurance company. These are a list of fees charged for specific medical service and procedures. And these are set by the provider or the insurance company. Okay, this is your fee schedule. Okay, this is your fee schedule. A payment arrangement where physician or healthcare provider is paid a set amount per patient, regardless of the number of services provided. So a payment arrangement where physician or healthcare provider is paid a set amount per patient, regardless of the number of services provided. So they get paid based on how many patients. So paid a set amount per patient, regardless of the number of services provided. So they're paid a set amount based on how many patients are in that plan. So this is capitation, guys. Capitation. I didn't really see anybody unless it's maybe it's delayed on YouTube, but this is capitation. So with capitation payments, the provider is paid per patient that is enrolled in the plan or per member that is in the plan, no matter how many services. So this is usually with HMOs. This is how providers are usually paid by HMOs, okay? With the capitation system where they're paid per member or how many patients are enrolled, okay? The process of confirming that a patient's insurance is active and that they are covered for specific medical services. What is this process called? Confirming that a patient's insurance is active and that they are covered for specific medical services. Hey, Veronica, long time no see. Long time no see, Veronica. Yep, eligibility verification. So you are verifying their eligibility. Elle said, I remember you said it, but couldn't remember what it was. Are you referring to the capitation, Elle? A healthcare provider who does not have a contract with the patient's insurance company, often resulting in higher costs for the patient. What is this type of provider called? This is a healthcare provider who does not have a contract with the patient's insurance company, and it often results in higher costs for the patient. I'm glad to see you here, Veronica. Yeah, Veronica is one of my day ones since I started going live on here. Veronica been hanging in there. Yep, if you put out a network provider, yes, you are correct. So this means that the provider is not in network with the insurance company. Now we know with HMOs, they can't go out of network. They got to stay in network, right? And they got to have a referral to see a specialist and all of that good stuff. With PPOs, though, PPOs can go out of network. All right. A healthcare payment model where providers are paid for each individual service or procedure provided to a patient rather than a fixed payment for patient care. So you know how we said the capitation was based on how many patients? This one is paid for the services and procedures. With this type of model, they're paid for each individual service or procedure. Let me see. Where's my Facebook? Okay, I see somebody. Hi, Gerald. Gerald is on Facebook. Y'all were typing it earlier. A few people typed it earlier, fee for service. I saw y'all typing it earlier, but I didn't want to mention it because I knew it was coming up. But a few of y'all put fee for service for capitation. So the difference between the two is that with fee for service, think about it, a fee for service. They get a fee for their service, okay? They're paid per procedure and services they provide, whereas capitation, they're paid based on how many members are enrolled in that plan, okay? They're paid per member or per patient. Okay, guys, this is the end. Let me know if you have any questions before I get off here. Do me a favor and like the video if you enjoyed this, if this was helpful to you. Do you guys have any questions? One thing I want to reiterate, if you did not while you were going through this, make sure you take notes. If you need to go back and watch it, do so. But anything on here that you didn't recognize, yeah, Veronica, you came on a little late. But we had 30 altogether, 30 terms altogether. I did. But guys, if you have any questions, let me know real quick. Put it in the chat. But I want you guys to make sure you take notes. Anything that you didn't notice, I know there was a couple of people that said that they weren't sure of the answer. So things like that. So for the administrative part, Make sure you know the differences, between your PPMO, HMO, your parts of Medicare, right? Those accounting terms like your accounts receivable and accounts payable, right? Your fee for service versus your capitation. What else did we go over? Your EOB, explanation of benefits, versus assignment of benefits, coordination of benefits. If you guys missed yesterday, I gave some study tips. So if you're on here today and you were not on here yesterday, you missed some study tips. I gave some study tips. So make sure you guys look at that video if you haven't already. So the way you rewatch Lakrita, you just, soon as I end this in a few minutes, it's going to be available to watch. It'll be right on my channel. Let me go to these comments. Hey, Gerald. MN says, no, I just came. It's okay, MN. It's going to be the video is going to stay up. Randy said, love these videos. I'll take my NHA exam in December. Okay, you got this, Randy. Okay, Elle said, I struggle with administration. This was very helpful. I'm glad to know that. I'm glad this was helpful. So just make sure you guys go, I hope you guys took notes. If you got to watch it again and take notes. Let me know if you, dang it, something else I was about to say. But anyway, guys, if you need any type of extra help, I do have an online study guide. I have an administrative portion. The administrative only study guide is $19.99, so $20. The clinical study guide is $27. Okay. It's at $27. The administrative is $19. And it's at marefreshercourse.com. So if anybody need a study guide, I have lessons in there. After each lesson, there is a quiz. Okay. And you get a certificate at the end when you finish the course. So it'll say, I took the medical assistant refresher course. You'll get a nice certificate at the end. After 2 years, I still watch the videos. They have lots of tips. Veronica has been here since day one. Let me put Veronica up on the screen because Veronica has been here since day one. I've been doing these videos for 2 years now, and Veronica has been here since day one. Somebody said, can you go back and review the quizzes? So, Brittany, so the quizzes you can only take one time. However, if you email me, I can reset it again. So you can look at them, but you won't be able to retake them. I wish, so the platform that I use, I wish they allowed, to retake the quizzes and all of that. But even on like the NHA website and stuff, like you can't even retake those. The website for the administrative is also marefreshercourse.com. It's the same. You just have to, when you click on it, when you go to marefreshercourse.com, you just have to, you'll see the clinical on top. And then when you scroll down, you'll see the administrative. So on the NHA, the only ones you can take again are the quizzes within the study guide, but the practice test you can't. But I wish the platform I used, I wish they allowed it to do it over and over. The only way, Brittany, if you're still watching, the only way that I can make it so you can take the quizzes over and over is if I have to enable, it's called course compliance, and that would mean that you have to go in order. The only way that you can take the quizzes over and over, if I enforce course compliance, that means that everybody that buys my course have to go in order. And I wanted people to be able to do whatever they wanted to do. I wanted people to be able to do, if they want to do it administrative first, they can do that. If they want to do medical emergencies first, they can do that, or anatomy and terminology. I didn't want people to have to go in order. So that's the only way that they will be able to do the quizzes if I enforce that. And I didn't want that. Like I work with a school, and the school has incorporated my study guide into their course. And the way he does it, he has them, assigned he assigned different modules from my course. So they don't go in order. They go in the order that he assigns them. Oh, you said you did bad on the terminology quiz. Send me an email, Ashley, to remind me. Just make sure it's from the email that you registered with, and I can reset your quiz. So anybody that is considering getting my study guide, you can, when you sign up, if you want to do a quiz again, you just have to email me, and then I can reset the quiz from my end. The CMA has practice questions that you can pay for after taking a sample quiz. Would you recommend it for the exam? Yeah, definitely. I listen, I recommend as many practice tests as you can, as many practice tests as you can buy that you can afford. I say go for it. The more you get exposed to, the better chance you have. Now, and if you can't, that's okay. But I mean, like people that can. So if somebody's like, listen, I'm gonna buy everything I need to, then you can go for it. But if you can't, it's okay. Yeah, Ashley. Yep. Just send me an email and I can refresh the quiz. It's no problem. And if you want to, Ashley, we just did before you do the quiz again, we did just go over terminology last week on this channel and on Facebook. So if you want to look at those first, you can. One thing I realized I need to do a video on the terminology. So I did a video on anatomy, but I don't have a video on terminology. I thought I did that, but then I remembered it was actually for the YouTube channel. So I need to do a video on that. But I did do a few videos last week here on YouTube. I should just upload those No, I don't want to do that because it's a live. It's going to be distractions. But don't worry, I'm going to upload a video for terminology too. Let me look on Instagram. I keep forgetting about Instagram. I'm sorry, Esley. Esley, would you? I see your question marks. Did you have a question, Esley? How often do you do lives? Brittany, this month, every single day. For the month of October, every day. After October, I don't know. It just depends. But I don't have a set schedule when I go live. The only time I have a set schedule when I go live is this month of October, because October 21st is Medical Assistant Appreciation Week. And I wanted to make October Medical Assistant Appreciation Month. So I decided to go live every single day. Other than that, I barely go live anymore. Is the administrative package on your website help with the CMA? Only the administrative portion of the CMAL. Only reason why I mentioned the administrative portion to you, because I know you said you struggle with that. But if you want like a broader, like if you want help with everything, then you want to get the clinical one, because the clinical study guide, it has both administrative and clinical. And the administrative is only administration. So like everything that's in the administrative study guide is in the clinical too, plus clinical. So if you're saying you're about to take the CMAA, AMA, you want the clinical study guide. The only people I recommend getting only the administrative package is if you are taking the CMAA or the CMAS. If your test is only administrative, then you can get that one. Or let's just say you are good on the clinical. You like, listen, I don't need everything else. I don't need patient care. I don't need what else? Phlebotomy. I don't need dosage calculations, because I have all of that in the clinical one. If you feel like you don't need none of that and you only need administrative, then fine. Then you get that one. My email is, so it depends on what you're emailing me about. If you have my course, if you're emailing me about the course, that's a different email. But if you just have a question, it's I'll put it in the chat. So you got to let me know, because it's a different email. If you just are like have a general question, you just email me at khartcpr. Just put it in the chat. So let me know, Lakrita, what your question is about, and I can tell you which email. Positions too. Yes, Veronica, I go over positions. Do I go over instruments? I touch on instruments, Veronica, just a few instruments that I know you need to know for the test. So I touch on like hemostats, making sure you know what hemostats are used for, suture, scissors, what else? Just a few, not all the instruments. Brittany says, I'm taking my test in November, so nervous. Listen, it's common to be nervous, Brittany. It's okay. Make sure you look at my study tip videos that I did yesterday if you didn't already. I did see you. Yes, I got the video on anatomy. I just didn't do the terminology one, Ashley. And then don't forget, just email me if you want me to reset that quiz. A CMAA study guide. So you're saying, so Lakrita, you want to you have my study guide already? So I have a well, it's for CMAA and CMAS, but it's at it's at marefreshercourse.com. So if you need that study guide, Lakrita, I don't have anything physical to send, So for those of you that's wondering, a few people asked me, do I have anything physical that you can download? Everything I do is all online. I don't have anything physical to send. On your study guides, they are separately like medical terminology. Yes. So Esley, on my study guide, they are separate. So medical term and anatomy, that is one module. So I have 12 modules all together. Matter of fact, let me give y'all a sneak peek real quick. Let me do this. Let me do this. Hang in there with me for a few more minutes, y'all. Let me show y'all my course really quickly, since you guys are asking about it. Hold on one second. Let me show it to you. Hold on one second for anybody that's wondering. Let me pull this up. Let me go to course. Because that's a good question, Esley. That's a really good question. So clinical preview. Okay, let me share this with you guys really quickly. Present, share screen. All right. So Esley, to answer your question, is broken up. So like this is overview and introduction. So let me click on foundational medical assistance. So that is one part right there. So this is a lesson, right? This is a lesson here. And then there's a quiz, which you see the score because I did a video. Let me go to one that I didn't do already. And then you have medical law and ethics. Again, it's a lesson. Okay, it's a lesson on there.
A provider can be sued for abandonment.
Okay, and then after the lesson, the reason why the quizzes are already done because I did videos going over them. Let me go to one I didn't do yet. Here's one. Okay, so a lesson, and this is an example of what I have in here. So this is a quiz. So which of the following will herpes fall under? Fungus, virus, parasite, or bacteria? Herpes is a virus. So you would choose it and hit check. So yeah, it's 12 different modules. So module 1 through 12 is here. And then you got other practices. So you notice you got quizzes within the lesson. And then you got 3 more practice tests at the end. And I'm working on the 4th practice test now. So hopefully that answered your question, Esley. Do we book a one-on-one on your MA refresher? If you want to book a phone call with me, you can. But it's different. So you can get the study guide if you want, or you can book a one-on-one at book. I'll put that in the chat. Bookwithmissk.com. I'll put that on Instagram since you're asking. Yes, it's for the CMA as well. Bookwithmissk.com. All right, guys, let me see. We almost at an hour. Is it condensed info? Yep. I created my study guides from using the test plans from NHA, from the NHA, the CMA, as well as the RMA, because I wanted to make sure I had everything. Lots of study materials on the files tab and Miss K page to download. Oh, she's talking about in my medical assistant group. That's true too. The medical assistant lounge. Do you have to pay for the sample quiz? It's for CMAA. I'm not sure which sample quiz you mean. Can we get certified through your course? So my course helps you to get certified, but the certificate you get at the end of my course, it is not a certification. It just shows that you went through a refresher course, but it's not certification. So no, it's not the same as being certified. You just get a certificate at the end that you completed an MA refresher course, but no, it's not a certification itself. It's not a certification itself. All right, guys, I'm going to go ahead and end this because I want to, oh shoot, we already at the hour mark. I was trying to end it before the hour mark. Yeah, Tiny, I can see it. I'm responding now. Can you hear me, Tiny? For the CMAA, that's what I didn't understand, Tiny. I didn't understand your question. You said something about a sample quiz. I'm not sure what you mean about sample quiz. I don't have any sample quizzes. Are you talking about the quiz that I just showed? So that quiz is included in the study guide if that's what you're asking. Hopefully I'm getting it correct. Hopefully I got it correct what you meant. Let me know, Tiny. Is that what you were saying? The quiz that I just showed? So it's not a sample quiz. It's just a quiz within the lesson. And then at the end, there are practice tests. There are 3 right now. And I'm working on a 4th practice test. You're welcome, Brittany. Hey, Colette. Hey, Heather. Heather, you always late. But I'm glad you're here. Better late than never. So are we supposed to be following the test outline? Nope. You don't have to follow the test outline. Nope. Nope. If you were here yesterday, right, Ashley, you want to break down your studying into chunks. So you don't have to follow it in order. You go by, you go by different topics. You don't have to go in order. No. So and as far as you do want to look at the test plan, the test outline as a checklist though. Yeah, you don't have to do it in order, but you do want to use the outline as a checklist. The test plan as a checklist. Oh, you graduated. Congratulations, Veronica. You're welcome, Tiny. I'm sorry that I was confused at first by your question. I'm sorry. All right, guys. Let me see if I see any other questions on Instagram. You're welcome, Ashley. Ashley on Instagram, been hanging in there all this week. Thank you for hanging in there with me, Ashley, all this week. I'll be going live again tomorrow night. Well, tomorrow, I don't know what time I'll be going live tomorrow. I don't know what time, guys. You just make sure you have your notifications on so you can be notified, because I can't guarantee that I can do every night. Sometimes I might have to go live during the day. Like Saturday, I might go live during the day, so it depends. I'm always studying, then I watch the videos. I wake up, medical assistant, and go to bed. Like medical assistant, wake up, medical assistant, go to bed. That's funny. That's why I'm saying, Heather, your life should be revolving. When you get ready for the test, your life should revolve around it. Thank you. I did it with all of your videos and following you. You are welcome. When you upload lesson 4, do we pay to view it even if I purchase your material? When you upload lesson 4, do we pay to view it? No. So if you get the study guide, you have it. So even if I add information to it, no, you don't pay for anything else. So like for an example, when people first started buying my study guide all of the modules weren't even done. So I have 12 modules. When people started buying it, I only had like 4 or 5 modules, and I've been adding them. So people have been buying my study guide while I was still working on it. I recently just finished it and I'm still adding to it. So to answer your question, once you have it, no matter what I add, you still have access, but you do have 3-month access and you have 6 months. I don't really think people need really 6 months access. If you're about to take your test, 3-month access is enough. And I think I may do a 1-month access too. I'm thinking about doing just a 1-month access as well for people that don't need it that long. Congratulations, Colette. Yeah, she passed yesterday. You're welcome. Congratulations. Congratulations to everybody that passed. All righty, guys. Let me see. Let me go through, make sure I didn't miss anything. You're welcome. Let me go back to Instagram really quickly. Okay, I just ended Instagram. All right, guys. Y'all have a good night. I will see y'all tomorrow. I don't know what time yet, but I will be live tomorrow. As I mentioned, every day this month, I will be going live. Y'all take care. Good night.